We have so many questions, so many things to get to. This is so important because so many of our young people, they not only get information from their friends, that's where I got information from when I was growing up, but they get it from the universe with all their devices, and they've been on online school all year. So they've had all the time to Google and sit on TikTok or wherever else they get information from. But as we know that so much of this is sometimes they're afraid to ask questions. And that's why we have the experts at University of Miami Miller School of Medicine and Jackson Health to give us all the latest. And so as you're filing in, we've got quite a few of you in the room. We're going to get started. Welcome to tonight's Parental Guidance seminar on sex education. Our expert tonight is Dr. Mikey Maurer. He is the Assistant Professor of Clinical Pediatrics with the University of Miami Miller School of Medicine. He's a lead pediatrician for the University of Miami. He's a board-certified general pediatrician. He currently serves as a lead pediatrician for Dr. John T. McDonald Foundation School Health Initiative, and as a pediatrician with the Pediatric Mobile Clinic. He completed medical school at Indiana University School of Medicine, and his pediatric residency was at Stanford in Palo Alto Hospital. He also did a residency at the Lucille Packard Children's Hospital. His primary clinical interests are adolescent health, sexual and reproductive health for teens, caring for the underserved and marginalized communities, telehealth care delivery, and high-level prevention medicine. His scholarly interests include social determinants of health, sexual and reproductive health, adolescent risk-taking behaviors, and immigrant health care. He is a fellow of the American Academy of Pediatrics and the Florida chapter of the American Association of Pediatrics. He serves as the Florida chapter of American Association of Pediatrics Diversity and Inclusion Task Force Chair, and is also a member of their Advocacy Subcommittee and School Health Task Force. Thank you, Dr. Maurer, for joining us this evening. So glad to have you.
Thank you, Nikki. It is so lovely to be here. I am just overwhelmed with the opportunity to have the chance to sit down and have a very, very open, honest discussion about what can be a very challenging topic in an area that I think a lot of parents maybe don't feel so comfortable approaching this topic with their children and their adolescents and their teenagers. And I'm hopefully gonna assuage some of the fears, worries, and preoccupations tonight and show you that it's possible to really engage with your kid when talking about anything related to sexual and reproductive health. It's, to me, one of the most important pressing matters facing our children and adolescents in today's society.
Yes, it certainly is. And Dr. Maurer, first question, I'm gonna throw you off. Who had the talk with you? Who gave you the talk?
Very, Nikki, the reason that I'm giving this talk is because I don't take this the wrong way. I love my parents so dearly, but nobody really gave me the talk. I'm going to be quite honest. I was sent to my class when I was in 5th grade. We're getting really honest here. So I was sitting in my 5th grade class, and I remember they separated the boys from the girls, and we watched our videos. And I just remember sitting there being utterly confused. I had absolutely no clue what was going on at that time. And looking back, it would have been really nice if I had had some preparation for some of that and had a place where I felt comfortable to sort of ask openly a lot of questions. Again, my parents are amazing human beings, and I love them very much. They got me to where I am today. But I had the talk in 5th grade from a video. That's all that it was.
So that leads me into at what age should we start talking to our kids about sexual and reproductive health?
This is just such a fundamental, important question that I think most of us are not sure what the exact answer is. There's not a perfect science to doing this, but the way that I view it is that we can provide medically accurate, age-appropriate sexual and reproductive health to children and adolescents at every single age. There are actually age-appropriate materials that have been created. A lot of it stems in schools, but for as young as 3 and 4 years of age. So we can begin having talks about our bodies. We can begin having talks about things that are age-appropriate from a super early age. And so
Wow.
most people think that they have to save the sex talk for when their child or becomes a teenager or adolescent or at some point later on in life. But it's truly a progression, a large sort of building game across their entire life, that we can begin from infancy and even earlier, where we begin talking and using appropriate anatomical terms for children regarding their reproductive organs.
So like a 2-year-old, what do you say? Because a lot of us have to put our kids to daycare.
Correct.
And so we really want to let them know it's not okay for people to touch you here or this. Is that the conversation you're talking about?
That's one of the most important conversations a parent can have with their child, about setting boundaries, about appropriate settings for when someone's able to look or touch or talk about those different sort of private parts of their bodies. And so when I even I even catch myself when I talk about private parts, I'm talking about penises and vaginas and our reproductive organs. So these are just other parts of our body that are exactly like our eyes and our ears and our hearts and our lungs. And it's something that we need to sort of begin to normalize more with our children. So I work with a lot of families that they use different names or sort of code names for their private parts, which can be really cutesy and it can be kind of funny. And when kids are really little and around the age of 3 and 4, they go through a very normal phase where they maybe start to touch themselves in their private region more often than usual, and parents come in totally nervous and they're like, I think my child is 4 years old and masturbating, and potentially their child was, because it's something that can actually happen when kids are.
But what do you say to them? We had somebody in the chat ask, what if their 4-year-old says, where do babies come from? What do you tell a 4-year-old? I mean, they can't understand that, the stork doesn't work anymore.
It doesn't. And so the way that we can begin talking about it is using language that they understand, saying that, and it also helps, maybe a mommy is pregnant when that 4-year-old's asking the question, or maybe they have a pregnant friend or something like that. And you can begin to say, well, babies come from our bodies. So what usually happens is that there's going to be apart from someone who's a man and apart from someone who's a woman, and together they're able to create a baby. But it comes from our bodies. Humans create babies. Storks don't bring babies, even though there are some really cute, wonderful storybooks that may bring that. But it's okay to be honest, but doing it in a way that maybe they'll understand. And truthfully, if your child starts to question, there's really it's never too early to begin teaching children anatomy. I'm going to be quite honest with that. And so we really can begin to have some of these conversations with children earlier. And it's a matter of the way that the child's actually asking the questions. But you can kind of divert that by saying, they come from our own bodies. There's a very special organ inside of our body that actually allows a baby to grow there. The other misconception that we teach kids is that it comes from mommy's stomach, which isn't the case, right? We all know that's not the case.
That's where everybody sees it, right? That's where
the belly is okay
it.
because we can consider that the general abdominal cavity if we're talking on a sort of medical term. But so the belly is okay. So even starting when they're younger, using some general terms like the belly, and as they get older, maybe start asking more questions, you can say, well, there is a special organ where babies are actually able to grow and develop. It's, to me, I actually, when I teach a little bit more in depth about sort of sexual health, especially to teenagers, I talk and even other adults and other sort of my trainees, my students and residents, I talk about how the uterus itself is actually my favorite organ, because it's so dynamic, and the changes that it undergoes every month on its own accord is just a really remarkable process. And then the entire ability to grow and provide nutrition to a growing fetus is just a total remarkable experience. And so it's pretty, for me, I like to share how to me it's the most fascinating part of a human body. So that's just something that I think is important.
Well, we listen, ladies.
It starts with talking about normal anatomy.
Well, those with the uterus, thank you for appreciating our greatness. Our greatness. If now there's a good chance a kid is going to hear something from a sibling. If there's a household with multiple ages there, how do you do that if you have kids of multiple ages, and do you discuss it individually or as a family?
So there are ways to have an entire family discussion about things related to sexual health and reproductive health. It's important that you also talk separately with that older child, because depending on their developmental stage, that child may be ready to process more information, and it may not be developmentally or age appropriate for someone who's, say, 12 or 13 years old to share certain information with a 4 or 5 year old. And so you actually need to talk with that older child about the ways that they can help be a part of the really healthy, normal growth and development of their younger sibling. It's not to spoil any surprises, but it's more to make sure that what we're delivering to our younger children is something that's medically accurate while still being age and developmentally appropriate for those children. So you can talk all together in somewhat general terms of sort of, oh, like, just know that you can always come to us. We can always talk about anything around these terms, but at every age, it's going to be different, the types of things that is appropriate and pertinent and important to know. And so then you can kind of talk about, if there is some bigger piece of information that has been relayed to a younger child at that point, I think there's not a whole lot of utility in hiding anything. Then you just say, well, let's talk about it. And we go from here. And then you also have to educate that child that kids their own age may not have heard or learned about those things. And so it's not necessarily their role or their job or appropriate for them to share that information, that it's up to their own parents to sort of discuss that information. So there's this whole process of talking to your kids about it.
We have so much to talk about. We want to get to one of these questions. I have a 13-year-old, and I told you I have a Girl Scout troop, and they're all around the same age, but puberty started differently for everybody. At what age does puberty start? And we've heard so many things about puberty starting earlier because of the food they're eating. Has that changed? Is that a real thing?
I am interested to know what everyone in the audience thinks is the age at which puberty starts, or the age at which puberty possibly
it's a question.
Start.
Let's throw it out there. Anybody want to answer?
That's what I'm
going to take okay, I see if somebody hold on. Somebody said 12, 7, 8.
All right.
10. Who wins the prize?
All right, wonderful. Well, Dina Garcia and Giancarlo David, they definitely are the closest. So from a medical perspective, we consider it completely normal for a girl, so a genetic female, to begin showing signs of secondary sexual characteristics as early as 8 years of age, so after their 8th birthday. So the first pubertal change that we usually see is a little bit of breast budding. So your daughter may begin to feel a little bit of breast tenderness. You may notice a little bit of change in the contour of her breasts, and if she's 8 years old, it's totally normal. There are actually a lot of reports where we do see kids that have a little breast budding at an earlier age. It's worth it to go and talk to your pediatrician if that were to happen, because we may need to do a little bit of evaluation. But by and large, most cases that even happen before 8 years of age are also completely normal, and there's nothing sort of scary or dangerous that's happening. But it's our job to just rule out those different scary and dangerous things that can happen. For boys, it starts about a year later. And so boys can start at the age of 9 years of age. And so the first sign that we see in boys, it's actually some testicular enlargement. And so that they may be at that age where you may not even know as a parent, because by the time they're 9 years of age, it's probably a lot less likely that you're actually going to be taking a look at your son's.
Right. I mean, some people bathe. At what age do you stop bathing with your kids? That's a question that we have too. At what age do you stop? I tried to make my daughter not ashamed of her body, but at a certain point in time, I told her, Dad, you got to stop walking around the house, because she went and told everybody in first grade, Daddy has a tail.
Oh my goodness. That's so cute. It's so cute and funny, but I actually am someone who, this is something that it really, there's not scientific evidence that nobody did a randomized controlled study comparing kids who, bathed with their parents naked compared to kids that didn't. And so we don't have scientific evidence to all of this. And so I do want to say that it's really going to depend on a lot of the family and parental preferences and the child what we know in a lot of pediatrics is that the child leads the way. At some point, the child is going to say, no, I'm ready to do this on my own and I don't need you there. So I'm someone that earlier to sort of stop doing some of those things earlier rather than later is better.
Okay.
There's not a clear-cut age where I would say stop bathing with their child. I think you always want to just make sure that your child is capable so that nothing dangerous or unsafe is going to happen. But I think teaching children about, their own personal privacy is going to be important. I think that we can focus on the concept of not being ashamed of your body and realizing that your body is normal, natural, and perfect the way that it is. But also realizing that there's a time and a place for people to see those specific parts that in our society we consider to be inappropriate to show in public, right? So talking about breasts,
and I think you're right.
Genitalia.
I think you're right. Following the kids' cues, because you notice your kid starts covering up. You notice your kid starts, and I feel like the parents of daughters, especially probably dads of daughters, have a bigger burden because they have to talk to them about their menstrual period. What kind of language do you give, especially dads, if he's a single dad or, parents are split and he's with his daughter some of the time, what do you tell them? How do you tell them to talk about that? Especially if they're a kid that's, girls can begin their period as young as 9.
Yeah, they can. So when we think about puberty starting at age 8, usually after breast budding begins, the first menstrual cycle happens anywhere from about 1.5 years to 2 years after that. So you're right, girls can begin having their menses as early as 9 years of age. When a girl starts to have her menses, I'm a firm believer in just discussing exactly what that is. So a menstrual cycle is not just having some vaginal bleeding that occurs most commonly every single month. The menstrual cycle is an entire process where the intention of that process at the end of it all is potentially going to be the birth of a whole new human. So I actually think that at age 9, it's okay to begin having some of those discussions about really when you talk about those, where do babies come from? Because that's the process that's at play.
If the kid walks away and you start talking about it? Because I bought my daughter the American Girl doll book. I don't know if you've ever seen it, but they have an American Girl doll book. And she's like, Mom, you traumatized me. I'm so traumatized by this. For us, it was, are you there, God? It's me, Margaret. That's what I had in my generation.
Yeah, so you're right. Some children, and again, it's all about that sort of that cognitive and mental developmental age as well. And so learning to talk to them in a language that they might understand, and again, letting them lead the way of saying, hey, listen, this is something that's really important for you and for your health and for your growth. It's something that's totally normal. It's something that every girl and woman goes through. And it's something that I think it would be important for us to have that conversation. If you're not ready to have it quite yet, that's okay. Just know that you can always come and talk to me about it. Or you can just say that, let me know when you're ready to have that conversation. You don't want to force it necessarily, but you can always sort of check in and see how it's going. You can also always offer to them, if you don't feel comfortable talking to me about it, we could talk to your doctor about it. So using your pediatrician as a really good resource to teach some of those topics is really worthwhile. It's something that I offer to all of my families. So I always say, okay, well, your daughter started her periods. It's important that we talk about truly what that is and what that means, so that years down the road, we're able to make sure that we are doing everything from a prevention standpoint to prevent potentially unintended or unplanned or unintended pregnancies. And so to me, it's something that we should always just be very honest with our children, let them know how important it is, that this is a totally normal part of growing up and developing, and that you're happy to chat with them about it when they feel comfortable and ready to do so. You also do have to there are certain things about, from the hygiene standpoint, that the kids don't get to, they don't get to have a pass on that, right?
That's scary. It's scary. This Deb in the chat and the questions asking, she said, what do you say to a 9-year-old brother or boy who hears the word period from his sister? How do you explain that to the brother?
Wonderful question. Who asked that?
Deb Aguila.
Thank you for asking that question. And I think another question we have is kind of similar. Do we teach boys and girls the same thing? We do. We teach boys and girls the exact same thing. So every time that I have a male patient in my office, I teach them the exact same content and information. We all need to know. We all need to know all of this information. So for a 9-year-old boy and he hears that his 10-year-old sister's having her period, it's time to sit them both down and talk about what a period is, because it's something that it's normal, natural, it's necessary, it's really important that we're having it. And having these discussions is something that we shouldn't shy away from. And we also need to kind of teach boys how important it is to be respectful, right? Because it's something that
make better husbands out there.
Right. It's something that boys don't go through. And so it's something that boys will never truly be able to understand. And so in that way, it's something that you have to start to build some of that understanding and that respect between genders. We do live in a society now where our goal is an equal playing field, and we really want to make it that way. And so for me, I'm going to teach my boys the same thing I teach my girls. It's just super important that they're all receiving the same unbiased, medically accurate information in a developmentally and age appropriate manner for sort of where they are.
That is so evolved, doctor. At what age should you recommend that a girl start seeing a gynecologist?
Again, there's not an exact age where that happens. And sometimes girls start to see a gynecologist at an earlier age just because they're having such, challenging menstrual irregularities. And so sometimes it's out of necessity, right? So there's a true medical reason that a female patient needs to go in to see a gynecologist. And there are certain things that can happen. So if there's a particular issue with the vagina or the vulva, which is the exterior portion of the female genitalia, or if there is an ovarian or uterine abnormality, then the child's going to need to see a gynecologist earlier. For people that don't necessarily have a medical indication to go see a gynecologist earlier, I think that following with your regular pediatrician all the way up until the 18 to 20 range is fine. But then I think once the patient is at a point where they're starting to feel as though they're at least getting closer to maybe beginning a family or maybe beginning to bear children, I think that getting in to see the gynecologist earlier, establish that good relationship, is going to be really important in the long term. So around that college age, maybe late high school, getting your child introduced to a gynecologist can be important. But truthfully, if parents want their kids to see a gynecologist at an earlier age, that's also okay. You can get them in to see and start having some of those conversations, especially if you're a parent who's very interested in using different methods of contraception or birth control. Usually gynecologists would see patients earlier, especially for some of the different insertion of those different types of contraceptives, like the intrauterine device and the Nexplanon. There are some pediatricians and adolescent medicine specialists that will do those procedures, but I think the individuals that are the most seasoned and well trained are going to be our OBGYNs.
Diana Puig has a question. She says, would you provide a private talk to a group of 11-year-old girls, or should they just come to your office?
We'll talk after. Send me an email.
I have a feeling you're going to be getting a lot of those requests. So, but because you certainly do have the language now. For many religious reasons, people do. First of all, they don't want to talk to their kids about this topic, but then they also say, "Well, I don't want my kid to have sex before they're married." Like, how do you address that? Because I grew up very, very Catholic. They did not talk about it, and the nuns tortured us with crazy videos. So Absolutely. You are in the middle of this, because sometimes the kids will talk to you, and you need to kind of bridge the whole family.
Right. This is I feel like every question is so important, right? I say that every time you ask me a question. This one's so crucial. Taking into account cultural and religious beliefs is just very critical when it comes to teaching about sexual and reproductive health. I do want to give the sort of caveat that I bring with me a lens of sort of classical medical training, that I like to practice evidence-based medicine. And so I do a lot of my education based off of data and statistics and research that I know. And so while I like to appreciate cultural beliefs and religious traditions, I also like to think about the concept of social responsibility across the board, because I've seen across every culture, across every religion, a adverse or negative outcome as in the sexual and reproductive health domain. And so I think it's really important for families to focus on how important their religious beliefs are, but then to also bring with them, again, that medically accurate side of teaching kids about their bodies, about teaching kids about their reproductive health. Just because you don't want your child to have sex doesn't mean that your adolescent who's having her periods doesn't understand why her period's occurring and how her period's occurring, right?
And I've heard that from a lot of really young teenage moms. They didn't know.
Yeah.
They didn't know, even in 2021, they didn't know that they were going to get pregnant. And that's, we want to, again, we have to, this next question is about if someone feels like their high school son, for instance, is having sexual relations with a girlfriend. They haven't spoken to him about it. How do they give them condoms? How do they talk contraception?
Yeah, so I love that you asked how do they talk contraception, because boys usually don't think about contraception as their problem. The boys need to start learning that contraception is exactly their problem. And that's what I teach a lot of my adolescent male patients. So just in general, if you're ever concerned or have a suspicion or think that your child is engaging in a sexual relationship, you can begin to just have sort of an open conversation, especially if you feel as though, maybe you don't necessarily agree that they are, but you realize that there's not a whole lot you can do to stop them from doing that in particular. It's also worthwhile to just sit down and say, listen, I don't know exactly what's happening. I don't know exactly what you're doing. You are at the age where maybe you're going to start engaging in these behaviors. And if you're going to engage in these behaviors, this is the safest way to do it. So a lot of the patients I have come into my office, they have never had sex before. They haven't even thought about it. When I ask them if they're, when I eventually get to that question in my interview with them, they all start like chuckling or laughing, or they're like, what are you talking about, dude? Like, absolutely not. Ew, gross. I'm like, well, that's okay. Like, there may come a day someday in your future where you are ready. And I may not talk to you the month before that's going to happen to make sure that everything is in place for you to not have an unplanned unintended pregnancy, or for you to contract a sexually transmitted infection, including HIV, things of that nature. And so what I like to just sort of say is, as a blanket statement, there's a safe way to go about doing this, whether you're doing it or not. And just know that if you do decide at any point to engage in this action, in this behavior, if you feel confident and ready to be able to do that, I want you to know that there are places that you can go to make sure that we're staying safe and protected, and that we're not going to have something like an unplanned unintended pregnancy occur. Condoms are just the beginning. So I usually, when I teach about condoms, I teach more about
what about the options? What about the options for contraception? Right. I mean, there's a lot more out here these days.
There are a lot more. I love the CDC has a really good breakdown of all of the different forms of contraception and birth control. And it puts it in sort of this tiered format that sort of shows the least effective ones, the medium effective ones, and then the most effective ones. And so that's a really good resource. What I usually send my teenagers to, it's a website that I think all of you parents are going to be provided in this resource afterwards. It's called bedsider.org. And it's really, it's great for teenagers. It's in a lot of language that they have. It has like infographics that make sense to them. And kids are able to access that website and explore a lot of, yes, we can post that, Susan, for sure. And it has a lot of options for the patient or individual themselves to go and explore. Now, when I have patients in my office, I have a lot of patients in my office that are sexually active.
You're scaring us.
I send them to this website, but I tell them to do it with their partner. So I like to teach both partners because they're equally important in deciding what's going to be the best decision for them as a couple, for them as a unit, and for them potentially in the future as a family, of knowing what their options are.
Yeah, we asked this earlier because obviously your patients are going to feel a lot more comfortable talking to you, about it. When is it something you talk to the parents about? Because is there patient confidentiality for a kid?
Right. That's so legally in the state of Florida, adolescents are able to receive sexual and reproductive health services, including pregnancy testing, testing and treatment for sexually transmitted infections, including HIV, as well as pregnancy management, actually, without the consent of a parent. Teenagers are not allowed to, or adolescents are not allowed to consent to a termination of pregnancy without a parent or guardian's consent. And they're not allowed to consent to pre-exposure prophylaxis for HIV management without a parent's consent, but they are able to access contraceptive management without a parent or guardian's their permission or consent. So teenagers are actually able to access a lot of things in the state of Florida, and in most states throughout the United States, this is actually the case. And so we actually can't disclose specific information to parents if an adolescent patient discloses that in confidence. My own personal practice is to have an open conversation with that adolescent to say, listen, it's safest and in your best interest that your parents are involved in this, because they're going to be able to support you. And I think that at the end of the day, a parent is going to be just so much more relieved that their child wants to be safe and is focusing on prevention of something happen, rather than learning later that something potentially bad or something adverse or negative or unexpected occurred, and that it sort of put their child at risk in some way. So we don't want it to get to that point.
Well, I'm glad that you're having these conversations with the kids and the parents, because again, parents, they may not have had access to a doctor like yourself when they were growing up. So finding the language is hard. In this day and age, kids are learning so much about identity. When you talk about, they suspect their kid may not be heterosexual, how do they start that identity conversation?
Yeah, I'm gonna, this is a topic that I'm still learning about so much. It's something that is just blossoming across the entire country when we're looking at sexual equality and all of the different challenges that different populations face. And so, where I grew up and then through all of my training, I personally didn't have exposure to a lot of different populations, including the trans community. And so there are a lot of different patients that I'm still learning a lot about. So I'm not going to pretend to know everything about everything, but
when is it a curiosity? When is it a curiosity that they're like, oh, I saw these two people kiss? And when is it, because some people went to college and had wild parties. I'm just saying, not me, maybe me, but it's like parents are like, gonna know, like, how am I gonna have this conversation with a kid that's starting? Because from everything that I've read, these kids start saying things very early that they feel like they're not this or they're this.
There's a potentially a shockingly high amount of teenagers, as they're sort of in early adolescence, they go through a period of same-sex attraction, and it's completely normal. And so I'll give you one example of kids, their best friends growing up many times tend to be the same gender as them. And so at some point, somebody may become a little confused of thinking of somebody as their best friend, but then also thinking they're so cool that am I actually attracted to that person? And so in a sexual manner or a romantic manner, or in a way that I didn't ever anticipate before. And that's something that's normal. So a lot of teenagers go through a period of same-sex attraction. It doesn't necessarily mean that they are bisexual. It doesn't mean that they are, lesbian or gay or whatever. It's
curious.
It's a part of, in many ways, normal adolescent sexual development is going through that period of sort of finding yourself, seeing what it is that you like, don't like, things of that nature. And so to begin having that conversation with them, it's definitely something that that child has to lead that discussion. What the job of the parent is to make sure that that home environment is a safe space for that child to be exactly who they are. What we see, and this is a part that not everyone will necessarily agree with me on, particularly as it pertains to different cultural and religious beliefs and practices. But what we know is the healthiest and safest for all children is that they grow up in an environment that supports them to be exactly how they identify and exactly who they are. And that's what we know from research, science, evidence basis. We hear a lot of really sad and devastating stories about kids that because of their sexual orientation or sexual identity or gender identity have just gone through really, really terrible situations. As an example, we have much higher rates of LGBTQ youth in the foster care system compared to heterosexual youth in the foster care system. So there are very important differences in those children and adolescents in particular. So the only recommendation I can give to all parents is to make your home environment as safe as you can to allow your child to explore who they are within boundaries, right? You know, something that could be dangerous to your child, but to allow them to at least express and explore who they are in a healthy manner is going to be something really important for, I believe, all families and all parents.
Yeah, Dr. Maurer, we've kept all of our participants. They all want to know, how do they get in touch with you? Where are you located? Your receptionist's phone is going to be blowing up tomorrow.
I have a very, very unique and a very special job and position. So I am the lead school health pediatrician. So I provide free medical care in 9 Title I schools that are part of Miami-Dade County. And so we work with a very underserved population. I would say about 75% of our students are Black African American, 24% are Hispanic Latino, and then 1% are white Caucasian other across the board in our 9 schools. Most of the clinics I work in are going to be in our high schools and middle schools. And so I would say I'm doing a lot of this sexual health counseling for a lot of these really more underserved teenagers, but a lot of ethnic and racial minority patients is largely my patient population. The other part of my job is I work on the pediatric mobile clinic, which provides free medical services to uninsured children and adolescents in Miami-Dade County. And we try to service the medical home for kids that don't have medical insurance. So
you're saying they can't make an appointment. They're going to have to stalk you.
Sorry.
They're going to stalk you. These mothers are going to, if they're mothers like me, they're going to stalk you. And we're just going to have to do another parental guidance seminar that the kids tune into. I think that's a great idea. And I want to let everyone know that on June 10th, we're going to do specifically a parental guidance seminar on transgender, transgender youth and children. And that we're going to keep, that's a whole other subject that has so many different layers to it. You talk so much about our kids watching stuff. And I even had an instance where one of my friends shared that their son had been watching some porn on Snapchat and they freaked out. And I'm like, how is, I wasn't that shocked by it, but how do you talk through it, what they're seeing? Because shouldn't you take that moment to explain to them what they're looking at rather than go, bad kid, bad kid?
Ooh, this is a deep topic, especially the sort of the harsh realities of social media is I think the foundational component of this. Pornographic material has been around for a very long time. And the industry is widely successful, and that's largely because a lot of people access it and use it. And so that's sort of the reality within the United States and across the world, is that it's this just very powerful industry. Now, social media has taken this concept of graphically inappropriate material and has just made it spread like wildfire. And it's really challenging. So this is where talking with your kids early about things that are appropriate and not appropriate to look at and to watch, it really comes into play. I cannot emphasize enough, as kids are growing up and there are different ages at which children acquire a cellular telephone that does have all of these different capabilities, at which point they start using social media. I'm someone who I would encourage parents to sort of hold off as
up on
long
the
as they
phone.
can. Hold off as long as they can. And then whenever you do allow your child, while they're a child, put your parental controls on there, right? Have access to different things. You don't want to invade their privacy, right? I don't want you reading their text messages between their friends necessarily, but it is important to talk about healthy social media use, healthy text messaging, things of that nature. Limiting their cell phone time and social media use is really, really important. It troubles me so much when kids spend just infinite hours on Snapchat. And maybe this is because I kind of grew up as all of this was booming. And so I bring with it that perspective of me I knew life without it, but I also know life with it and how we can't live without it anymore. So I've grown up sort of as this was all occurring. But when it comes to pornographic material, if you're worried about it, if you catch your child watching it, or if you learn that your child had watched it, you have to have a very, very serious conversation with that child about how unrealistic anything that they're probably going to see is on any of that material. It's up to your own personal family preferences as far as how much you discourage it or not. Just letting kids, again, I'm someone who's all about teaching kids the risks and consequences of a certain behavior, because there's going to come a day where your child leaves your house. They can watch as much pornographic material as they want. They can engage with people on their cell phones as much as they want when they're adults, and they're paying for it all on their own and things of that nature. It's your job when they're growing up to teach them how to do things in a healthy manner, to try to mitigate as much as you can some of those really scary risks that are taking place. So we know with anything, abstinence, it's really hard to do, and it also leads to a lot of resistance and fighting and reluctance. So it's talking about how do we use things in a healthy manner, and how do we go about that, because
and this goes hand in the next question goes hand in hand with that, because almost like if they're watching porn, we're going to have maybe a masturbation conversation.
Yeah, I was headed right there, because that's a completely normal part of adolescent sexual development, is exploring their own bodies in that way. And for boys, you may actually have a boy who wakes up with an erection in the morning, almost every single morning. It may happen. They may have what is classically called a wet dream, where they actually have the release of seminal fluid or of semen when they're sleeping at nighttime, and they may not know exactly what happened. But there is a physiologic mechanism behind actually having that ejaculation process take place for a boy. So if a boy begins to masturbate, it's not something that is bad or abnormal. Again, you have to talk to them about, there's a time and a place to engage in that behavior, and that we have to just make sure that it's not something that's interfering with sort of your accomplishing the rest of your life as well. And the same goes for girls. So as they become teenagers and adolescents, they're going to have a lot of sexual urges. I don't know if any of you have watched on Netflix, there's a really funny series. Oh my gosh, what's it called? Big Mouth is what it's called. And there's
check it out.
Character there. Oh my gosh, it's actually, I think it's quite funny, being a pediatrician who does a lot of sexual health work. It's about teenagers, but there's one character, it's called the hormone monster. And I kid you not, I do believe that there is something to that for these adolescents. There are just so many different new bursts of hormones. Tasha Mitchell loves Big Mouth.
You have some other fans. I have
really
to check it out.
It's not medically accurate, so don't use that to teach your children about sexual health.
Come on.
Please. But it's so funny. It's sort of that sort of over the top experience that a teenager might have, that unfortunately we as adults maybe will relate to. And so we can think back to when we had those sexual urges when we were growing up, and know that your teenager is going to have those.
And we have another question in the Q&A, and they want to know, at what age should we talk about masturbation? I mean, I've had parents that tell me their male toddlers, are obsessed with their body parts, and they think they're, having erections.
Yeah, so that does happen. So I have a lot of toddlers and sort of early childhood patients that do get an erection, and that's actually that is a process of their normal development. It usually doesn't persist for an incredibly long time beyond sort of 5 or 6 years of age, but it can. And so that's where we have to start from the very beginning, when it's appropriate to sort of touch yourself, where it's appropriate to touch yourself, when you're, in the privacy of your own home, not when you're out in public with other people or doing certain activities. We don't have to call it masturbation when they're that little, right? Even though that's what they may be
It's
doing.
curiosity.
It's curiosity. It's part of their I forget the exact term, but there is a specific developmental stage where kids go through that. It's sort of like the erogenital something stage. So it is something that's normal and does happen. To really talk about frank masturbation is as we sort of get into those puberty adolescent years. And you don't necessarily have to approach the topic and say, hey, it's normal if you want to sort of touch yourself. Like, that's so weird. You don't want to be the creepy parent talking to your kids, right? But again, you want to leave that open stage and space to say, we can talk about whatever you want to talk about. And I'm here to give you advice and guidance, because there's a chance that I maybe even went through it when I was your age as well. I've been there, done that. Let's just have an open conversation about
The
it.
teenage brain is so sensitive. I feel like I could talk to my child better at 8 or 9 than 13.
Yeah, so that's why I always, when my patients, they're all my kids. When all of my patients are in that 7, 8, 9-year range, that's why when a girl starts to have breast budding, I start to talk to parents about what's coming next. And I, talking to them about when their menstrual cycle is going to happen, and that this is an important time to start talking about their anatomy, their bodies, their development, and ultimately making it a safe space to talk about those topics when they're 8, 9, 10. So when they're 13, 14, they're still going to go through their like rebellious phase where they're a little like, no, I don't want to talk to you about anything. But it just makes it a little bit more safe if we start having those conversations when they're really young.
Yeah. Deb has another really great question. She said, who should have what conversation? Mom, dad, if you're the luxury of having mom and dad, should mom talk to their daughter? Should dad talk to the sons? Do they receive it better? I always feel, my kid receives everything better from her father because I'm the bad guy, but
anyone and everyone. So at this day and age, we have a lot of modern families. So we have families of all sorts, right? And so I myself am part of the LGBTQ community. And so, when I have a daughter, she doesn't have a choice. It's going to be your dad is going to talk to you, right? So,
all her friends are going to come talk to you. All of them.
Your dad's going to talk to you. So it's truthfully, I would prefer that both parents are there at the same time, that you guys are sort of this united front. Again, you don't want to gang up, but it is important that you guys sort of share that uniform message of this is.
We just got fathers in the delivery room like 30 years ago, Dr. Maurer. Fathers just came in the delivery room like 30 years ago. You think I don't think they're lining up to talk about the periods yet.
So ultimately,
but some have to.
Some absolutely have to, and some really want to. It's going to depend on each parent's own life experiences and what they went through and what your beliefs and customs and emotions are related to it. But I encourage everyone to at least leave the door open for their kids to talk about. But I don't believe that only men should talk to boys and only the moms should talk to their daughters. I think that everyone can talk about everything, because at this point, we all need to understand every part of this process. And so it's really important, especially, I think one important topic that we haven't touched on yet is teaching our kids about consent, which we talked a little bit about when kids are really young, what's appropriate touching and appropriate, who can look in this area, and for what reasons can people look in this area or potentially touch this area of their body. But when we're talking about the consent process of sort of, you can never do something more than what anyone else is willing to allow you to do to them, and they have to give you that verbal consent to be able to do so. That conversation can happen with everyone, and I actually encourage a lot, all parents to talk to their kids. That's where I think the two-parent method
let's talk
way.
about consent. Let's expand on that. Let's talk about consent for a toddler. Let's talk about consent for a 9-year-old. Let's talk about consent for someone that could be active.
Yeah, I have a really frightening story. So this is so funny. My sister is a public school teacher, and she teaches elementary school, 4th, 5th grade. And we were talking one day, and she told me that one of her, I think 4th grader, I forget what, either 4th or 5th grade, the grade really doesn't matter because what I'm about to tell you is shocking. And the child was getting in trouble because he was kind of annoying a girl. That was a boy student who was annoying a girl. And at one point he says, "I'm going to shove my D up your A." Wow. And so this is coming from a kid who's like 10 or 11 at the oldest, right? And so it's something where from a very early age, we have to talk to them about appropriately respecting everyone around you, and when it comes to anything of that nature, that we cannot joke about touching somebody or doing something inappropriate, because it's just not okay.
The kids model certain behavior. I remember in daycare, my daughter was 4, and I got another boy in her class said, "Come be my girlfriend and sit on my lap, because this is what my dad's girlfriend does." And I was like, could y'all separate those kids, please?
Yeah. So when they're really young, it's very basics of,
innocent.
I'm your mom, this is the doctor, we're the only people that should ever be, checking in this region, and that's a lot of what it is. But as they grow older, you are going to start, that was a 4-year-old, right, doing some of that stuff. And so it is important that we as parents are modeling that behavior and saying, these are things that mommy and daddy can do, or mommy and mommy can do, or daddy and daddy can do, because we're adults, and we're married, or we're in a committed relationship, or because we have grown up, and now that we're older, we're able to do things like kiss each other on the lips, right? So when you're younger, it's not really appropriate to do that to other kids in your class, right, against their will, right? So there are things that we can talk to kids at every stage. It's going to vary, especially once they get into school and they're exposed to so many new things, and kids are all raised very differently, and so they're going to hear things and see things, and kids are going to say things around them. And so it's your job to sort of redirect them and say, hey, listen, their parents are raising them in one way, but I really think that it's best if we talk about it from this perspective, that we always have to respect other people, and we don't want to ever physically touch someone, particularly in any of these sort of special areas, like on the chest or sort of in their groin region, because it's not appropriate to do so, especially if they don't give you the permission to do that. But at the end of the day, it's really important that we get the permission of anyone that we're wanting to engage in any level of physical contact, and that we can't say things regarding the somebody else's physical appearance in that same regard. So you can start having conversations like that at a pretty early age as well. But so much is going to depend on what the child is exposed to around them in the community, and the questions that they bring home as well.
No, absolutely. Speaking of schools, is sexual education, how is it taught in schools? Is it being taught enough? I mean, you can still opt out. I mean, I got the form in 5th grade, I believe it was. What is that evolving somewhat? It depends from state to state.
We could go down a really big rabbit hole for this one. So it does depend state to state. So most states have an opt-out process. I don't know where it was sort of arbitrarily decided that in 5th grade is where a lot of kids get that first sort of growth and development lecture. But at the end of the day, every state sets its statutes differently. So in the state of Florida, at least in the public school system, currently, there is language that permits comprehensive sexual and reproductive health education to be taught. It does have a recommended curriculum, but it does not mandate that there's comprehensive sexual and reproductive health taught in all schools. So there is a curriculum that has been approved by the Department of Education for K through 12. I don't believe it's been implemented in the vast majority of places. For example, this also at the same time as the state statute and the requirement for someone to graduate from high school is only 0.5 credits of health education overall. So we're talking general health education. The only the requirement is 0.5 credit hours to graduate. And so if you're thinking about incorporating the sexual health component or sexual and reproductive health component, it tends to get pushed to the wayside. I think they do a very brief, these are what the STDs are, and this is HIV, and plus minus if they even talk about condoms or any sort of birth control contraception. Basic anatomy is not generally taught in most instances, especially reproductive anatomy. Yeah. Aside from those sort of 5th grade videos, but not in an effective manner.
I'm so glad you brought up HIV. People don't realize HIV is still out there.
Oh yeah.
Talk about STDs. Like, how do you have this conversation? If you have a kid, how does a parent know if their kid has an STD? And, they're not going to come talk to it. It's really hard for them to get them to come talk, but they're going to have to talk to somebody.
Yeah, STDs are really tricky. So prevention is key when it comes to sexually transmitted infections. In my job in particular, unfortunately, prevention is some of the harder parts. So we actually do a lot of testing for the students that are in our schools. So we actually have a formal relationship with the Department of Health for their HIV and STD surveillance programs, and we actually serve as official testing sites in our high school clinics, which is really awesome. Unfortunately, across the board, well, in our clinics, I've seen about 15% of the students that we test have chlamydia. So we have some pretty high rates of STDs among our teenagers and adolescents, and just generally across the United States, the 15 to 19-year-old kids, the rates of STDs are actually increing. So we do know that.
Are there home kits?
Are there home kits? There are
testing kits.
So, I've actually seen commercials for these on TV. So it's kind of like, I feel like it started as these like food sensitivity kits, but now they're sort of branching out into all sorts of things. And so there are some home STD testing kits. I think that, linking into your pediatrician, or actually there are specific sites that are Department of Health sites, which are important. So all sexually transmitted infections are considered reportable diseases. And so every time someone's positive, our health department needs to know about that. And so I actually really like just recommending people go to the health department for any of this screening and testing and potential treatment. Again, teenagers are able to access all of that confidentially without the consent of their parents. So if you're concerned that your child might have an STD, I'd be really interested to know how you learned about any symptoms they may be having. But if you're just wanting your child to maybe get tested for a screening purpose, if you know that your child is in a relationship where they are engaging in sexual activity, it's where you can sort of step in and be that educator about prevention, and for both your child as well as their partner or their significant other, saying, listen, the smartest thing here is for both of you to get tested for all of these STDs, make sure that nobody has any, or if somebody does, that you get treated, and then once you are able to engage in that, to make sure that there's not going to be any transmission of STDs. For parents who suspect that their kids are having multiple partners, because let me tell you, it's somewhere in like 30 to 30-ish, 30 to 40% of high school seniors who have ever had sex have more than 4 partners. And that's what we have from a data perspective. So if you're suspecting that your child maybe has multiple partners, that's even more important to get on sort of a standing schedule for, STDs every 3 months to do it. It's part of your health. Chlamydia in particular, the vast majority of cases are asymptomatic. So especially for males, over 90% of cases are asymptomatic. For girls, a little less. They may have a little bit of vaginal discharge. Gonorrhea tends to be a little bit more symptomatic. Syphilis is always symptomatic. It doesn't hide, but the initial syphilis infection is something that may not necessarily be noticed, and it goes away relatively quickly. And so then you think that there's nothing going on at that point. HIV, typically the natural course of HIV is where you may have just what you think is like a viral illness. You think you just have like the flu or something. It goes away, and then HIV can actually be asymptomatic for about 10 years afterwards, but you could actually be positive and able to be to transmit HIV to other people and not have a single symptom for about a decade. And then
can you test your children without their permission? Say I brought my daughter to the doctor and we were doing blood work, yearly blood work.
That is a very big ethical challenge.
I mean, I go to the doctor every year and I get a full panel of work. So, I mean, I don't know for my kid, it's the same, if I could do the same.
So my own practice is that I engage the adolescents themselves, and I say, and once I sort of learn about their risk factors for maybe contracting an STD, which for me, a risk factor for contracting an STD is having had any sort of sexual activity once in your life. So I have a really low threshold for testing my kids and screening them for any STDs, including HIV. Testing an adolescent without their consent is not something that I would feel comfortable doing. I think that just involves a larger conversation, at which point you can eventually, probably using the appropriate interviewing techniques, would be able to get your teenager to agree to testing. They may begrudgingly do the testing, but I think that it's worth having a conversation. I never want to force someone to do something that they don't want to do. HIV is a little different than the other STDs. It's treated a little bit differently. It is a very specialized consent process, and we are not allowed to test people for HIV without their consent in particular. But for anything medically related, I'm definitely not going to do any procedure whatsoever without that patient's consent in particular. It does become a really fine line, because when they're little, the parent can say, oh, check their blood work, and we're going to check them, check their blood work. And the 6 or 7 year old probably isn't they don't have a choice. They don't have a say in the matter. But as they develop some of that autonomy as a teenager, it's important to engage them in that conversation and do more teaching about why it's so important that they're taking care of their health. And that it's better to know,
because it can have later consequences when they want to become a parent, when they want to do this. All has consequences. You need to put out a whole line of videos, because if this is one of these times, you're going to be glad this is virtual, because if we were in person, there'd be a line out the hall. You'd never get home tonight. Because thank you so much. This has been so awesome. This has helped so many of us. And I know I'm the moderator, but I'm a parent first, every day, all day. And we need to put out a bunch of your videos. We're going to have this on our jacksonevents.org website, so you can share with your friends. Thank you so much, Dr. Maurer. Thank you so much for the work you're doing in our community. And, we hear our additional resources there: expertskidscare.org, talkwithyourkids.org, amaze.org, cdc.gov/sexual health for more videos, tips, and resources. Again, jacksonevents.org. In 2 weeks, Thursday, May 20th, we're going to do the Parental Guidance Seminar of Healthy Pregnancies, Healthy Babies. Going to have all about starting the journey before you have to use this. If you're a new parent, especially, you have to use all these conversations that Dr. Maurer just went through with all of us, but it's so needed. And I can't believe where the time went, but so many conversations. And again, on June 10th, we're going to have a whole conversation about how do you talk to your kids about transgender issues. That needs a whole hour on its own. We appreciate you, Dr. Maurer, this evening. I feel blessed to have moderated this parental guidance seminar. Have a good evening, everyone, and stay tuned and stay engaged. And most of all, stay safe out there.
Thank you so much. This was such a pleasure and honor to be able to share some of my experience with you all. I really appreciate being able to be here. And I'm going to put a plug in for amaze.org. I think amaze.org is amazing. It's really useful, especially if you're not sure exactly how to teach your kid about a topic. There's probably a video there that's going to help you sort of set the